Good afternoon. Welcome to the University of Louisville Masters in Science Health Administration information session. I am Lee Bewley. I'm coming to you here live from downtown Louisville in the Health Science Center campus of the University of Louisville. Happy New Year to all those folks that are out there. We're recording this session for folks to go back and to review, or for folks who registered for this information session but were unable to attend directly. They'll be able to review the session after the fact. We've got a 15 or 20 minute presentation of information, content about our program and our graduate certificate programs that historically students, prospective students and applicants have been interested in. And then we'll open up the session for any questions you may have, ranging anywhere from admissions processes, standards, what the experience is for a student in our program, what type of developmental resources, opportunities, networking opportunities, or life and career as an alumnus of our program. And so we'll answer all those questions you have. And as always, I am happy to answer any questions directly. You can email me at lee.bewley@louisville.edu. Our program coordinator, Mr. Brian Mathis, is also on this call and can answer questions for you about admission to the program. And then beyond, as a student, you can contact any of us. So I'm going to share my slide set. Again, it's about 15 or 20 minutes of content, and then I'll open up the floor to questions. You can answer those questions either by typing the questions in the chat box, and I'll answer them after I complete the presentation. Or at the end of the presentation, you can raise your hand, open up your microphone or your camera, and/or camera, definitely the microphone so I can hear you, and I'll answer those questions. So without further ado, let me share this slide set. All right. Can someone confirm that you see the slides? I just want to make sure.
Confirmed.
Thank you, sir. I appreciate it. All right. Again, welcome. I'm Lee Bewley. I have the honor of being Program Director of the University of Louisville Masters in Science Health Administration program. I also serve as the Regent for the Kentucky chapter of the American College of Healthcare Executives. It's a professional organization dedicated to the development of competent leaders of healthcare across America. There are about 1,000 members in the state of Kentucky and tens of thousands of members across healthcare organizations and systems across the United States that are dedicated to serving communities. And our motto is for leaders who care directly and for communities. And so we incorporate that professional development of our students into the program. I have a chance as Regent to be able to share our development and opportunities for our students, but also have our students and our program provide solutions for the communities and for the health organizations in Kentucky. All right. So before we dive into the program, just a bit of perspective on why a career in healthcare management. For folks that are already working in healthcare, you probably have a good sense, but if you're new or transitioning, think about these points strategically in terms of an economy and a potential for a career pathway. Nearly 1/5 of the American economy is dedicated to healthcare. And quite frankly, I was watching an episode of Landman, and they were talking about energy, is that all of the rest of the economy is somewhat dependent upon or draws a basis from healthcare. The capacity of people to have a healthy life and be able to interact, to work, and to be able to participate in society is dedicated to our aspect of this care. So the thing is that despite having about 1/5 of our economy dedicated to healthcare, our outcomes in terms of our clinical outcomes, our medical outcomes, our public health, population health outcomes are not as good as other countries, which provides dual opportunities as a healthcare manager, a healthcare leader, to focus on how we use our resources, and more specifically, how do we use the resources that we've allocated to the most efficient and the most effective way. Efficiency is all about taking what you have and using it according to a plan, with greatest adherence to the plan. The effectiveness is making sure that the way that you use your resources are in ways that are appropriate to your mission or why your organization or your community exists. Bureau of Labor Statistics finds that the median healthcare manager salary in America is $118,000. That's the median, so it's right squarely in the middle. It includes both multimillionaires and folks that maybe had their first health administration or health management job, in the $50,000 or $60,000 range. But the median income is substantially above the median income of a family of four in our state and across the country. And the rate of growth in healthcare administration is 29%, which is substantially higher. And it goes to this point, I think, strategically, is that we need competent people who can organize healthcare resources to efficient and effective manner. Looking ahead, what does the successful or competent healthcare leader need to focus on? Number one is population health management. All of those resources that we use in markets and communities require more effective and efficient utilization. And how you're going to be able to achieve those effects, you're going to need to be able to incorporate new financial models. It's not just fee for service, but finding ways to take, in some cases, buckets of resources or sharing risk across payers and, in some cases, patients, but also the providers, and leveraging information systems, which includes artificial intelligence. But the bottom line is that we work in the people business. And so as a healthcare leader or manager, you need to be first to be able to be an effective leader within your own organization. There are three responses to leadership. There's simple compliance in the middle, but there's also resistance, but commitment. And those organizations that have effective leaders tend to be able to achieve higher levels of commitment to organizational goals. But the other element essential for a healthcare leader in the 21st century is to be able to lead outside your own organization. And that includes stakeholders, but also to be a leader in your community, to be able to organize the activities and efforts of health in your community in a way that you're part of the community and you're serving while you're managing the business aspects of a healthcare organization. All right, where are the different roles? I'm not going to go through all of the different aspects of healthcare management, but essentially, if you find an organization that is directly or indirectly leading to the care of individuals that has a budget, has people, and has customers, you will find health administrators. And that ranges from hospitals and health systems to entrepreneurs, innovators, consultants. And so everywhere in between, health insurance, federal government, state government, private organizations, the ability to plan, organize, lead, and control an organization in a healthcare setting is the work of health administration. And the roles start at the operational level. You can be a manager, a coordinator, analyst, or specialist. You can work your way up to being a vice president, director, or at the C-suite level, CEO, president, or you could be the owner or partner of an organization. Why healthcare Louisville and Kentucky? We believe that we operate in a nexus of a great learning laboratory. We have major health systems here in the city of Louisville, including University of Louisville Health, but Norton and Baptist. We have healthcare organizations that are headquartered here, Humana, Kindred, Trilogy, and a number of different partners that are out there that provide both a learning lab for our students that are either working in those healthcare organizations or they have internships, or we bring the work of those organizations into our classroom. We incorporate them in some of our cases. We have students that are able to interact with those healthcare leaders and executives, and sometimes in those professional organizations such as American College of Healthcare Executives or the Healthcare Financial Management Association. Of course, this is a great place to live and work, that if healthcare education brings you to Louisville, you come to Louisville, you may want to stay here and serve this community and as part of this vibrant healthcare community. We continue to evolve this. This is not an exhaustive list. We have students that work all across the country, in fact, all across the world, and a few other continents as well. And so our students, upon graduation, either move up in their own organizations or they take administrative fellowships or first, entry-level roles, or they move to another level across healthcare organizations across the system. What are we primarily in the business of? We're building leaders. The ability to plan, organize, lead, and control in a manner that demonstrates honor, integrity, and professionalism will allow a successful leader to be able to achieve higher levels of outcomes, to serve communities, to be able to meet organizational goals. And so the core aspect, you can demonstrate honor, integrity, professionalism, you can lead, but the bottom and essential element is that leaders in healthcare must be competent. The old saying that you hear with a little bit of tongue-in-cheek, perhaps, of fake it till you make it, is not relevant in healthcare. People, both within the organization, the families and the patients that we serve, demand that We have a competence, both in clinical application of healthcare, but also in the management of resources to ensure that people receive quality care. And so the content in our courses, every course has essential competencies that we provide instruction, development, and then evaluation and feedback, so that you know that at the completion of this program, completing all the courses and all the evaluation materials and receiving that feedback, that you will have a standing of competence, that you will be able to go out and to competently lead in health organizations serving people and communities. So we're not going to break our arm patting ourselves on the back, but we do have credentials. Our school, Public Health and Information Sciences, is accredited by CEF. That's the Council for Accreditation Public Health. Our program is one of the accredited programs across the country. The Commission on Accreditation of Healthcare Management Education, of which I happen to be an accreditation official for CAHME. We're currently ranked number 46 of 158 accredited programs. We're not satisfied. We're always looking to move up the ranks. And the primary way that we'll move up the ranks is attracting great candidates that come to our program and go out and do great things in the community. And so that dual CEF accreditation and CAHME accreditation is positively distinctive. And so if you're looking for an accredited healthcare management program that includes the elements of public health, which we believe supports the population health perspective that 21st century healthcare leaders will need, then this is a great place to be able to learn. Quick snapshot on our curriculum. We've recently updated our curriculum. We follow a competency model that holds that all of the courses in our curriculum should contribute to the competency model. So every single course, from that PHMS 505 Government Management Healthcare Organizations to the final course, the MSHA capstone course, contributes to the competency model, so that at the close of the program, all of the essential competencies based on the National Center for Healthcare Leadership competency model will be addressed in terms of development, but also evaluation and feedback. And so those 43 credit hours, those 15 courses, are presented for our students in an online format in 8-week terms. And so Fall 1 and Fall 2 are, the Fall 1 8-week is from August through the beginning of October. And then Fall 2 is the beginning of October through the beginning of December. We have a break for most of December, first few days of January. Spring 1 begins usually the second week of January and goes through the beginning of March. Spring 2 is from the beginning of March to the first week in May. And then the summer 8-week is, generally speaking, the month of June and July. And so there's a bit of a break between Spring 2 and the summer, and a bit of a break at the end of July before classes begin in August. And so we have some natural breaks in there. But all of our courses, the 15 courses, are offered once per year, except the PHMS 690 capstone course. We provide a pathway that if students are seeking to graduate on an expedited basis, there is a way that students can take that final course in the Fall 2 of the year. Our academic advisors will go through your flight plan in terms of which courses you enroll, but generally speaking, most of our students graduate in a 2-year period. And so they matriculate in the fall, and so they will choose 2 or 3 courses in Fall 1, 2 or 3 in Fall 2, and then working their way similarly, culminating with the final enrollment in which they take the capstone course. And so we can go through the details with each individual student. A student can complete the program in as many as 5 or more years if you're on a part-time basis, either through work requirements or you're trying to match employer benefits with your academic plan. On the other hand, you can graduate in as soon as 15 or 16 months by taking the expedited route. There is no required practicum for students that come into the program with at least 5 or more years of organizational experience. We are creating an option with students that have less than 5 years of experience that you can be admitted to the program, but we would have a required practicum, and you will see that option open in our catalog syllabus for the next academic year. But currently, for this 43 credit hour program, students admitted, there is no required practicum. And the thought there is that people that come in with 5 or more years of organizational experience, you're already practicing healthcare management. You are not required to have an additional practicum experience to demonstrate that you have that integrative learning experience. In fact, you'll probably be using the experiences you have in your own workplace within the course itself through discussion boards, some of your projects. We want to create an option with this online program that if people are new to healthcare, perhaps they have no healthcare experience or only a year or two, they could still complete this program, but we would have them have a practicum experience, and we would set specific targets for them to have projects during their academic experience to demonstrate the integrative learning. Happy to answer any additional questions for that in Q&A or on the side. All right, bring up a couple of points. We have 3 healthcare management related certificates. We have a 12 credit hour healthcare management certificate, a 12 credit healthcare financial management certificate, and a 12 credit hour healthcare quality and project management certificate. These 3 certificates are intended on 2 parts. One, if an individual simply wanted to have a graduate certificate that was matched to a current job or role, perhaps a physician that is going to be taking on a healthcare management role, doesn't want to complete the full graduate program right now, but would like to have just-in-time graduate education experience in healthcare management, or perhaps somebody's in a budget role. They want to take that healthcare financial management, or similarly, continuing education and development for all of healthcare. They may want to pursue that healthcare quality and project management certificate. If a student, I guess what I'm saying is, if a prospective student does not want to seek the full degree at this time and wanted sort of just-in-time or continuing education, graduate education that comes with a graduate certificate from the University of Louisville, we have those 3 graduate certificates. Those graduate certificate courses are co-enrolled with the MSHA program, and so students in both certificates and the full degree program are taking classes together. An extended point, and which goes to the second point, is that perhaps some students want to try a certificate first, achieve that certificate, and then transition to the full degree program. That's perfectly fine. Requires a separate application, so you would apply separately for the certificate and then the degree. But here's the thing: if you earn an A or B in those graduate certificate courses, and you earn the certificate, for instance, the healthcare management certificate, then those credits that you earn at A or B will translate directly into credit for the MSHA. Let me extend another point a bit further. If you simply are aiming and interested in the MSHA degree, there is no need or requirement to pursue those certificates. A CAHME accredited MSHA graduate degree that includes all of those competencies and developments manifest in any one of those certificates, and in fact all of the certificates, is more than represented with an MSHA. And again, happy to answer any extended questions that you have about the connectivity of the association between the certificate pathway or the degree pathway, or degree or certificate and then degree. All right, so a couple of program highlights, and I'll close out this session. I promise you 15 or 20 minutes. We are very strongly associated with the American College of Healthcare Executives. One, it provides a basis and pathway to ensure that our curriculum forever remains relevant to the problems and issues and opportunities in healthcare, but it also provides a basis for networking for our students, resources. Kentucky chapter of ACHE, and of course National ACHE, provide resources to our students through scholarships. They provide stipends to attend the National ACHE Congress. There's essay contest, and there's also opportunities to be able to pursue jobs afterwards, or even to be able to have a case where that you can have class sessions that we will often will have students where they will have interactions with students, in the local area, either within Kentucky or the greater Kentuckiana area. We often have seminars or sessions, or for students that are out of state, if you're an ACHE member, you can attend as a student in one of the local clusters. And so ACHE provides a framework within the Kentucky area, but also all across the country, that student and associates have a graduate program that is part of the American College of Healthcare Executives Higher Education Network, can be able to have networking and continuing education development opportunities all across the country. Our students participate in case study and graduate essay competitions. One of our students won the ACHE National Essay Contest a few years ago, Rachel Peril. We've had a number of students over the years, have either finalists or semifinalists for these case study competitions. In fact, just a few months ago, one of our students from our online track participated in the Penn State case study competition, and they were semifinalists in that competition. So students in those case study competitions, they get the opportunities for development, they get to network and interact with students. And if you win show or place, win first, second, or third, and sometimes fourth or fifth, the scholarship money, you get to keep that yourself. Any trophies, any awards, you get to keep those. But if there are any registration fees or any travel expenses associated with the case study competition, the program covers that. We do this because we want you to have those opportunities for development on an extramural basis. It also helps us be able to evaluate the development of our students, paired up against students from other CAHME accredited programs. And so we provide those resources for development, but also for evaluation to make our place out there in the world. And remember those national rankings. When our students do well, we tend to see those reflected most directly in the way that our students participate. And it's almost like AP rankings in a way. When you perform well on the court or on the football field or gridiron, when you perform out there in the field, it's reflected in the rankings. Because we're a CAHME accredited program, there are a number of national and regional administrative fellowships that, as a graduate of a CAHME accredited program, you can apply for these postgraduate developmental opportunities they're essentially full-time jobs with a major hospital or health system in which for 1 or 2 years you work as a postgraduate projects, and you have a mentor, a preceptor, and those fellowships often translate directly into full-time employment with that organization. Our faculty are doctorally educated. We have a number of healthcare executives that are both board certified and come with experience. We have 2 great executive in residence, a former chief medical officer and a former director of population health here in Louisville. Very strongly tied to CAHME, the accrediting body, and the Association of University Programs of Health Administration. Our program is offered in 8-week terms in order to provide focused, concentrated education for working professionals. So you may only take 0, 1, or 2, or in many cases 3 courses in an 8-week term. We sort of call it that you can tap on the brakes or mash on the gas, whatever is most appropriate for you based on your work environment and your ability to be able to effectively complete courses and your professional work. We provide that flexibility. Again, a student could complete our program as soon as 15 or 16 weeks or up to 5+ years within the University of Louisville guidelines for graduate education experience. So you can map out your cardinal degree pathway. All right. One more slide. Oh. Getting a bit of a delay in my slide set. All right, that's it. That's the final point. We have an inquiry form if you want to use your phone and send that information in. But I'm the program director, Lee Bewley. Our director of student recruitment is Deep Jane. Admissions counselor Jennifer McLean. We need to have Brian Mathis on here, but we matriculate once a year in August. And so if you have a application or at least start by July 1st, you will be considered. We have capacity to serve students. And so this isn't a case of whether or not we have 2 candidates and they're somewhat equally qualified and which one gets in. We're a public institution. We are dedicated to serving students that meet our admissions criteria, and we have a spot for you. The university has some scholarship resources that are available. The program does not have direct scholarships. Here at our school and our university, graduate awards are provided at the university level. And so if you're admitted into the program, you could apply for those scholarships. There's priority before March 1st. What is it that is required? We need to have your official transcripts. We need to have a resume or CV, a letter of introduction, in which basically we want to know your why. Like why are you pursuing this MSHA? How does it fit into your life career goals? Then 3 references. You can have the references can be a simple memorandum for record or a memorandum of reference. And I think the grad school, I think we have forms that an individual could fill out. We use the HAMCUS consolidated application service, and of course you can always apply directly through University of Louisville. A quick note on the application guidelines. Our current criteria is that you must have 5 or more years of organizational experience. That doesn't have to be in healthcare. It is also waiverable. And as I alluded to earlier, as we transition our program, to fully online, for those students that have little or no healthcare experience but want to get into healthcare, you can still be admitted to the program, and we can create we will have a practical experience that will allow you to be able to have that integrative learning experience. So I'll close the presentation for now, and then open up the floor for any questions that you may have.
I do have a question.
Yes.
So I currently work for the University of Louisville, and I was wondering what's the earliest that we will know if we got in or not, if I complete my application right now?
Great question.
Because I need to know by like March.
Great question. Excellent. Thank you. In fact, I'm sorry I did not address that point. Here's the brass tacks of the matter. We process applications as they come in. We don't batch 3, 4, 5, 6 of them up and then have a committee meeting. We accept those applications. And so if you complete an application, and I'm just going to use this to illustrate, if you complete an application today, then within the next 2 to 3 weeks, you should receive an interview to evaluate your standing, and we will make the admissions decision and requisition there. So usually within 2 to 4 weeks of completion of the application, you'll receive notification. We have, I guess another way of saying is, we have continuous admissions processes. And so as soon as we have a completed packet for admissions, we will schedule an interview. And the interview, quite frankly, it's not we are simply wanting to make sure that our program is a match for what you are looking for, and that we want to make sure that you are a match for our program. We want, for the students that are admitted to our program, there is a very high degree completion rate. The worst thing that we could have happen is that someone would somewhat be lukewarmly interested in health administration. We don't do an interview. They don't talk to us beforehand. They take a few classes and they're like, oh, I guess this is interesting, but it's not really for me. And they don't take any classes anymore. We want folks that have a clear view of the way forward. So to the two parts to it is we really embrace these interviews as that final step to locking in that, hey, this is somebody that we want to have join our MSHA Cardinal community and to join the ranks, as healthcare leaders and managers. But to answer your direct question, usually 2 to 4 weeks from the time that your admissions packet is completed, you will be able to have an admissions decision.
Thank you.
You're welcome.
And then also have another question. So could we complete our degree faster? So I know that it said in the from fall to usually the summer and July. What if we wanted to graduate again by that May?
I'm going to show a slide. I'm going to go back and show that slide. The soonest matriculation graduation period would be that a student would matriculate in August, and they would say August of 2026, and then graduate. The soonest you could graduate would be December of 2027. The reason is that we have a schedule of courses that we offer, and so I'm just trying to see whether or not I can share that slide set. We don't have all of the courses offered all the time, if that answers your question directly. And so we have to follow the course scheduled sequencing for when students take the courses. And so the 2 times that students would normally be able to graduate would either be in December or in the summer. And so that graduation timeline of August of 2026 to December of 2027 is about as fast as it can be. I mean, for the credit hours that we have, I'm aware that there's some programs that you may be able to graduate faster, but they probably have fewer credit hours. And they may have more class offerings, I'm not sure, but 15, what is it? September, October, November, December. So 16 months would be the fastest that a student could graduate. And that would require academic performance of a 3.5 to 4.0 in the first semester. The standard university load for graduate education is 12 credit hours. Our deans will provide permission for students to take more than 12 credit hours in a term with good to excellent academic performance. And so if you enroll in the first courses and you earn a 3.5 or higher, then the deans will approve being able to take the higher levels of credits that allow you to graduate sooner.
Okay, and so I think that we get done in the summer if we do a full-time track. We get done in the summer, and you said about July. So will we have to wait until December to graduate, or we
Nope.
just okay in the summertime?
The university confers degrees at the end of the spring, at the end of the summer, and the end of December. Now, just for everybody's purpose, it was a little bit of a lesson learned for me too, is that though there's 3 times that the university confers degrees, there's 2 graduation ceremonies. There's not a summer graduation. The KFC Yum Center downtown, I was just there a few weeks ago. So if you graduate in the summer, most students participate. If you want to walk the stage, you walk the stage in the December graduation. So you can have your degree. You'll have your transcript. You can go out to your employer or go out on the job market. If you graduate in the summer, you're a graduate. But for family and community, walking the stage at the KFC Yum Center and the whole pomp, it's cool. It's almost like game day. Game day at U of L last night up until halftime. But the thing is that you walk the stage either in December or you walk the stage in May for the spring ceremony. All right. Any additional questions? Am I on track, Brian? Have I any other elements to add or something am I missed?
No, sir. I think you covered it really well. I'll drop my email in the chat as well in case there's any inquiries down the road. Feel free to reach out to me. I'll usually respond later that day or the next day at the latest.
All right. Well, outstanding. All right. I'm going to have one more. Any questions? All right. Well, I appreciate your time. It's a great day here at U of L. Sun is shining. I think let's make 2026 a great year. I hope if you have any interest and you would like to take the next steps, I'm looking forward to your application. If we can provide any additional information, one-on-one, or if you want to email me, please don't hesitate to do so. Oh, Sarah, please, we can go into overtime. What questions do you have?
Hello, sorry I'm late. I thought it was at 12:30.
No
but
problem.
I just wanted to ask. Sorry, and I'm also out to eat. But I just wanted to ask you about the residency. Do you guys have administration residencies included in the MSHA program?
So, we will have a practicum experience for students that have less than 5 years of organizational experience. If you're referring to, I completed it for my own MHA program. I had an administrative residency that was 1 year following the didactic phase. Our program does not have a formal residency. What's more, what our program has been able to have for the past 5 or 6 years is that in lieu of a residency, a number of our students, we probably have 10 or 15 students that complete our program and then apply for an administrative fellowship immediately following graduation. And so the work of an administrative fellow and an administrative resident is practically the same in terms of development, sponsorship by a preceptor. The difference is that a resident, I think that's what was embedded in your question, the residency, you're still a graduate student, you're still part of the program, and your degree is contingent upon completing the residency. With a administrative fellowship, you have graduated from the program, but you immediately following the program, you will complete a fellowship. And so out in America, all across the country, in fact, a number of our students, when they apply for administrative fellowships, they might be next to a student that's in a program that has one of these residencies, and they're also applying. So in terms of development, what some programs would offer an administrative residency, we pathway to an administrative fellowship. A close cousin to that residency or fellowship is an internship. We do not require an internship for students that have 5 or more years of organizational experience, but for those students that have a less than 5 years experience, really in that 0, 1, 2, or 3, then we will have a required internship that we would coordinate with the student with a healthcare organization that either they're working in at the time or that is that they can work within the period of their program. That's a lot. Did I answer your question? Or
Okay. Yeah, that does. Thank you for all of that. Because my most important thing is just getting experience within a
yes, ma'am.
graduate program. And I know that I've seen some programs that have that administration residency and they also require a certain amount of hours for it and stuff. But I've also seen the fellowship thing as well. And I know that you all are CAHME accredited. So I'm sure I would be able to get into that too. So I just wanted to like hop on and see like if I can get any experience out of this program aside from just taking the courses.
Yes, ma'am. The one thing about it is that, and this is a case-by-case basis, is that part of it is where you are. If you're in Louisville or the greater metropolitan area, earlier in the presentation, we highlighted our working with professional organizations, the American College of Healthcare Executives, the Healthcare Financial Management Association, is that within our state and region and across the country with HFMA and ACHE National, we have network connections, and that the earn and learn model that you're describing, we either incorporate that through the professional organizations, either in the job hunt, or if you're currently working in a role that is entry level, associate, or you're looking to move up to manager or director perspective, from your own healthcare organization, coupled with the professional organizations, we seek either summer internships or opportunities to both dually go to school to have the healthcare job that in your current location and interact with healthcare professionals at the educational clusters across the state or the region, the National ACHE Congress, but also in opportunities, again, to set the basis to apply for an administrative fellowship postgraduate that really is a springboard to serving as an executive. You don't have to have an administrative fellowship to be a healthcare executive in America. In fact, most executives have not been administrative fellows, but statistically speaking, if you're selected for an administrative fellowship, you tend to move into executive roles faster and to be able to have those opportunities. And so that's our primary focus. And part of that is having our relationships with HFMA, with ACHE, having participation in case study competitions, the essay contest, and having those opportunities in the program so that when you go into the fellowship application process, there is a substantial basis of development that increases the likelihoods for selection.
Thank you for that. Yeah, that's very important, just having that experience there. But I would definitely be applying. Thank
Okay.
you.
Oh, outstanding. Well, thank you, ma'am.
And then I also have another question. So, would you say your advisors are like very knowledgeable on the fellowships, that the different ones that are close and in the city? Because also I want to make my bachelor's degree useful too. So I would like to, combine those two skills because I'm finishing up my bachelor's degree in social work, and then I want to get one in healthcare administration too. So are they knowledgeable on the combination of degrees and what would be a successful route for me?
So I'm an example of, so we have academic advisors that are also faculty members. And so I'm a board certified healthcare executive and a professor. I'm very familiar with the administrative fellowships that are in the state of Kentucky. As the regent for ACHE, I'm asked to provide letters of recommendation to be able to give feedback on administrative fellows. So yes, I'm very familiar with the fellowship opportunities within the state of Kentucky. In fact, just this past year, we organized the first joint administrative fellowship symposium for all the fellowships across the state of Kentucky. It was conducted here in Louisville, and one of our students was selected for one of those fellowships, and will likely be, she's going to the University of Kentucky Medical Center for her administrative fellowship, will be one of the fellows who organized that activity next year. And then we have placements in administrative fellowships literally all across the country, from California to North Carolina, South Carolina, Kansas, Iowa, Illinois, Ohio. I'm not all 50 states, but I have students' faces in my mind, that we make placements. So every year since we've had an MSHA program, we've had placements in administrative fellowships. And so we have a pretty good working knowledge of what it takes to be selected, as well as a network of folks to be able to have some feedback on what those individual fellowship sites are looking for in candidates.
And then I have one more question. Can you send me that slideshow that you had?
Sure.
And then that's my very last question.
No problem. In fact, that's a great, I'm happy to drop that in there right now. And so as I probably won't be able to attach it while it's open, but I will, as soon as we are off this session, I'll make sure that it's uploaded and you get a copy. All right.
Okay, thank you.
You are welcome. So, barring any additional questions, again, I will put this out if I can answer. In fact, I think I was going to see whether or not I could. I will send this. I think that I can't actually attach. I will send you all. It should be on the chat. It'll be an attachment on this chat on your Microsoft Teams, and so I'll make sure that you all get a copy. All right, well, ladies and gentlemen, I hope you all enjoy the rest of the day. It's a sunshiny day here in Kentucky in downtown Louisville. If I can be any help or assistance at any time in the process, and of course, I'm looking forward, if you join the MSHA Cardinal community, anything that I can do for you then and into your future, please let me know. All right, take care. Have a great day.
You too.